Oh, good morning. Good morning from wherever you're watching us from. I welcome you to yet another very good morning. We are so privileged this morning to be here again. I greet you all in the name of Jesus Christ, and I hope you're having a lovely Sunday. It's a beautiful Sunday from our studios. We are happy. We are excited about the month of July. We are excited about what the month has for us. We're also excited that we're having a new team of specialists join our panel here at Mr.Selfcare Live. And we're excited about that. Today is a Sunday. And if you're watching us for the very first time, oops. If you're watching us for the very first time, I welcome you in a special way. I welcome you in a special way, and I kindly ask you to subscribe. I kindly ask you to make this your home page, your home channel every Sunday morning, where we meet to talk about a different health care issues. This morning, we are starting a very important series. We are starting a very important series. We are starting something that is new. To some family, it's called witchcraft. To some family, it is called obuko. To some family, it is called a dogo. We are going to talk about something that is very important. Today, we want to talk to a family that has a child that has been declared autistic. We want to talk to a family that has a relative that was declared autistic. We want to speak to a family that has had some fears or some worries or some myths that one of their children could be autistic. We want to speak to a family that is supporting an autistic child. We want to speak to a couple that is observing progress of a child that is not coming out in a way that you're expecting. The neighbors have started telling you things. We want to speak about something that for so long in Africa, we thought it was non-existent. We thought it was a disease of the white. We thought it was something to do with the Western world, but not an African problem. We want to speak something that in the future is going to be in and every family in Uganda, and yet little emphasis has been paid towards that disease. Ladies and gentlemen, we want to talk about autism in a theme that we are going to call light blue, meaning creating awareness for autism. We are going to have interactions from different experts. Today we are privileged that we have one of our very own, Dr. Kagombero Brian, who is on the front line in providing services, in providing autistic care to children that have been diagnosed with autism. He's going to talk to us. He's going to teach us about autism in so many ways. We are going to understand what it means, how we detect it, where to go, management, the myth, and then how to support especially children in terms of speaking or in terms of speech, because many autistic children suffer with speech problem. Mr. Brian, you are welcome, and kindly introduce yourself to our viewers by telling us who you are, where you work, and what you do exactly in the autistic community or society.
Good morning, our dear viewers. My name is Brian Kagombero. I'm a speech and language therapist. Today, I want to share with you something that is part of my heart and my experience. I'm a speech and language therapist. I work at Mulago National Referral Hospital. I also work with parents. In various capacities in helping children with autism spectrum disorder. Yes.
Okay.
I would like to share with you my views. Yes, thank you.
Okay. Mr. Brian, you're welcome. You're welcome to our studios, and we are privileged to have you here. This is Mr. Selfcare Live that happens every Sunday at 7 a.m. And we are happy that finally we have you on our panel of discussants of healthcare workers that have come out to support us in educating the masses. Let us go, or let us dive straight into the topic. Mr. Brian, what is autism? And what would be your definition of autism to the viewers of this channel this morning?
Yes, autism spectrum disorders, as it is mostly scientifically called, is a developmental disorder that affects children's interaction, communication, and behaviors. In other words, children don't behave as you'd expect them to behave. They tend to not speak as early as other children. They tend not to act in a way that you'd say typical with other children. Yes.
Should we say that autism is a behavioral disease just? Is it a neurological disease? Is it a cellular disease? How does it affect our children, or how does it come to affect the behavior of this child?
Yes, autism is a neurological disorder, meaning that there are brain changes that can be found out with children with autism that are not typical of individuals. For example, children with autism tend to not interact so well with human beings, and instead interact better with inanimate objects, or what you'd call things like gadgets, toys. So with a simple MRI scan, you'll see that clear difference in the interaction. Yes.
Okay, so in other words, somehow in their brain, they are wired to not to interact more with us human beings, but rather with gadgets and what?
Yes.
Could it be the reason this generation, a lot of us are more interested in phones and gadgets than people? Could it be that actually most of us are autistic, only that maybe we've not had the proper diagnosis from people? Anyway, Mr. Brian, take us through, how do we get autism? Is it something that if I'm autistic as a father, my children would have? Is it something that is acquired through maybe bacterial infection, airborne? Um, Tell us, I know it may not be a clear-cut answer, but according to you scientists, what do you think is the actual cause of autism? How do we get it?
Just like you've said, there's no clear-cut cause known about autism, but there are what we would call predisposing factors, a number of factors that we could say would put you in the line of either being autistic or having a child with autism. One of the predisposing factors, that means that if you have a parent who has autism, there's a high chance that yourself, you'll have autism. A second predisposing factor is the paternal age. Men above 40 years of age have a higher chance with autism. The third one is environment. The environment does not really cause, but the environment can provide the best place for autism to thrive. In other words, environments that are less socially interactive play a big role in enabling a child to show their autistic traits more. Yes.
So you're trying to tell, actually, you're telling us that when women delay to have children, say we have children above the age of 40, there are higher chances that we are going to have children with autism. Is that what
Yes.
you're... Okay. It does not confirm that everyone above 40 years is going to, but there are higher chances.
No, no, not everyone. They are just higher chances by research and statistics.
Okay. So, where I come from, there are a lot of myths about autism. I have a DM that I actually direct message that has just come in from one of my colleagues saying when they had their children diagnosed with autism, for the first many months of life, they would not admit it. And even the closest people always told them it is witchcraft. Mr. Brian, you as a doctor that deals straight with these families and children, what are some of the myths that you've found or experienced around autism in our community and society in Uganda?
Yes, a number of the myths that we get to hear about regarding autism include number one, witchcraft. A number of parents have been told that probably somebody bewitched them, or maybe their in-laws, or maybe an enemy at their workplace bewitched them, and therefore they have given birth to a child with autism, which is not clear. It's not clear cut because all over the world, whether in China or the US or the UK, autism is everywhere. Then number two, a second myth is about uncaring mothers. A number of people believe that every child with autism is a result of a mother who did not take enough care of the child, did not feed the child well, did not talk to the child enough, did not push the child enough, which is not true in essence, because a variety of mothers of different characteristics have been found to have children with autism. Yes.
Okay. So to my viewers out there, when you have an autistic child in your family, do not point fingers. Do not say the mother is not caring. Do not say, oh, maybe the mother did not push well. Because actually, as some of the first children we had with autism in Uganda, we used always to put it to delayed labor. Omukyala teyasindise mwana mu budde. Maybe omukyala did not take enough drugs. The problem of autism, according from you, seems to be actually a big problem. Mr. Brian, what's the prevalence of autism today? How many out of years?
Currently in Uganda, we don't have clear research statistics regarding the prevalence, but in the Western world, especially in the USA, the current prevalence, according to the CDC, is 1 in 31 children born. Every 1 in 31 children born, according to the CDC, is autistic. Yes, which, just as you've seen, is a very high prevalence.
Okay.
Yes.
So everyone in 31 children is autistic. This brings me back to another question, Mr. Brian. When we were growing up, this used not to be the case. Like, these are things we never even thought about, autism or something. What could be the reason why today we are having a high prevalence of autism? Is it because of improved detection, improved diagnosis? What could be the reason as to why we are having this number of autistic children go up?
Yes. So when we talk of autism spectrum disorder, we see it as a spectrum, meaning it has point A to point Z. Yes. And along that spectrum, there are many different individuals that can be all classified to be autistic. They have different characteristics individually, but there are some specific things that lump them all into the autism spectrum disorder. So the reason why now we are seeing that there are so many, like the prevalence is high, is number one, the labeling. At first, when they talked of autism spectrum disorder, the labeling was not so clear, meaning what is autism, what could it be, what is it like. But now the labeling is more clear. When we see this and that, this person is autistic.
Yes.
Yes. So therefore now we can easily identify more people to be on the autistic spectrum. Then number two, the population. The population right from before was low. So therefore, the number of individuals born with autism definitely is low. But now we are having high population. Like the world, we are having around 7 to 8 billion individuals. While around 50 years back, we were having probably 1 billion to 2 billion individuals. So therefore, also the number of autistic people has grown exponentially. Yes.
Okay, so this means actually with Uganda almost getting to 50 million people, the chances of having more autistic children in Uganda are high
Definitely.
compared to what it was when we had
Definitely.
15 million people. Mr. Brian, take us through the spectrum. You said that one of the things that has helped to actually diagnose more children with the autism is now the discovery or the abundance of a clear spectrum that clearly puts this is witchcraft, this is autism. Because one of the other things that we use actually to confirm, especially from the imaging world or from me that is a diagnostic expert, was actually differentiating between autism signs with neurologic, especially brain defects. Children that used to have maybe ventriculomegaly or hydrocephalus, all of them almost used to exhibit the same symptoms. Abaana abalina amazzi mu mutwe oba abaana abazaliddwa n'emitwe eminene. We always used to confuse them to be autistic. Take us through this spectrum that you use to, what are some of the things, or I would call them, should we call them signs? Should we?
Yes.
Okay, take us through the spectrum or the signs that a
So,
parent out there or someone out there would look out for and say, okay, I think this is autism. Because I'm telling you, even as we speak, I know there are millions of undetected autistic cases in our population.
yes. So literally, we are talking about the diagnosis of autism. The diagnosis of autism, currently we follow a criteria put forward by the USA American Psychological Association under their manual, the Diagnostic Statistical Manual of Mental Disorders. And it is in different phases. Currently, we are on the fifth phase. Yes. Now, regarding the autism spectrum disorder, just like I said earlier on, over time, the labels have kept changing as what autism is has been refined and clearly defined over time. So, according to the DSM-5, the Diagnostic Statistical Manual 5, we look at autism to specifically show two areas of challenges. One is challenges in social communication. Once a child is exhibiting challenges in social communication, there's a high chance they are autistic. Then number two is atypical behaviors, or behaviors that you don't usually see in typical children. Yes, a number of these behaviors can be like flapping hands, jumping in one place over and over again, doing it every day, rigidity in routine, doing things the same way over and over again, arranging things in a particular over and over again, all of a sudden exhibiting anger and aggression due to a certain change around them, that these behaviors are not typical of children. Maybe blocking ears after hearing a specific sound, yes, or doing what we'd call empty gazes. They look at they look up at something, or corner eyes, they look in the corner of their eye over and over time. Something that you don't expect to be seen in a typical child. And the autistic spectrum has very many children, but exhibiting these two particular things that we have talked about. They have to have difficulties in social communication, interacting with others, and they have to exhibit atypical behaviors in order for us to say that this individual is autistic. And the specific professionals that work in the diagnosis of autism spectrum are currently psychiatrists, clinical psychologists, neurologists, and behavioral therapists. Yes.
Mr. Brian, you've talked about a lot of things here. You've talked about I know this is like taking you back, but I want you to throw more light on each of these. Like, for example, you've talked about social communication disorders. You've talked about jumping in one place. I clearly want you to take a little more minutes in clearly throw more examples to a friend of mine. I come from Katente. I always want to tell I come from Katente. I always love the King Saha song ebiseera ebyo njukira munga tukyali e Katente mu kipale kya Seno. So I always when we are hosting this channel is for the local woman in Ibujiri, where I know Ibujiri is close to where you come from. I want you to throw more light that if that local woman is able to listen to this program, they are able to clearly detect that the grandchild they are looking after or they are taking care of is not actually witchcraft. Kindly throw more light on each of these signs. Like when you say social communication behavior, what do you mean? What clearly can a local woman in Ikatente look at and say, I think my child is having social behavior issues? One of our supporters here is Edisa Foundation, and Edisa Foundation is actually looking after a number of children, and some of the children they look after at Edisa Foundations, some of them exhibit such behavior. How do the directors of this organization actually look, detect and say, no, this child is not stubborn? When you solve aggressive behavior, what do you mean? Can you clearly go through those points one by one, clearly putting it in the simplest terms and clearly giving examples? Clear examples to our setting, especially in Africa or Uganda. Thank you.
Yes. So what I'm going to do is just break down right from birth and over the childhood age and characteristics that you should expect.
Exactly.
Yes. Now, right from birth, even before I say that, there are two other criteria that we can use for looking at autism. Yes, we have autism that exhibits itself right from birth, and we have autism that appears around the time of approaching 2 years of age. Yes, so that appears right from birth, you can look at it as an aggressive form of autism, meaning it starts right from the beginning. While that appears around 2 years of age, we call it regressive autism or late autism, meaning it starts when the child is at 2 years. So with aggressive autism, right from birth, when the child is born, they are not able to provide eye contact. They can't look the mother in the eyes. They are not able to make those baby sounds. Many parents will tell you that their children were quiet babies, that my boy was very quiet. Yes, my boy did not cry a lot, slept most of the time. Yes, most cases, that's a characteristic of aggressive autism or birth onset autism. Another one is at around the age when you expect the child to start babbling, at around 7 months, 6 months of age, for the child to say ba ba ba, da da da, ma ma ma. The child is either quiet or they are still making delayed sounds. They are making sounds, they are still coo, what we call cooing, coo coo coo, ga ga ga. Those baby sounds of 1 month, 2 months, 3 months. Yes. Then at around 1 year of age, when you expect the child to say their first word, the child is not saying any word. And even at that point, the child is not yet making eye contact. They're not looking at you in the face. They're not interacting. You call them, they act like they're not hearing you. Once in a while, they'll turn to you and look at you, but most of the time they don't. And most cases, they are only looking at their own. They are mostly interested in toys, interested in particular items, maybe their pillow, their baby doll, or when they come to you, they hold your hand and take you to what they want, but they won't look at you in the face and ask you for what they want. While on regressive autism, the child is developing normally. You see everything is going on well. Then at around 1.5 years of age, as you're approaching 2 years of age, you start seeing changes. The child who had already said saying mommy, daddy, is no longer saying mommy, daddy. Or who was having many words is now the words are reducing. Who was more interactive is now less interactive. Who was playful with other children is now less playful. They are alone most of the time. They prefer to be alone, maybe in a corner or in their room. Or when you take them to other children, they don't interact or run around with them. When the other children are on the swing, for him, he has gone to the slide where there's nobody. Yes. So we see all these characteristics as the child is developing. Then you start seeing the child when there's a sound around, an awkward sound around, you see them blocking their ears, you see them making noise. Yes, or maybe there are lights around, they act that like they are troubled by even changes in lights. Yes, like they are very sensitive. Yes. And also another common characteristic is their senses are exaggerated. Their senses are exaggerated. What you expect them, a typical person, to feel is normal. To them, it is not normal. For example, the sense of touch. There are those who won't want hugs. You can't. The mother or the daddy or any other individual comes to give them a hug, they push away. While others are on the opposite side. They want hugs. They want to be hugged all the time. They want to be hugged all the time. Yes. You find others, they like climbing. When you take them even to a new house where you visit a visitor, I mean, you go and visit somebody and you find them climbing the table, climbing the windows. Yes, like they want to be up all the time. So also another one is their sense of touch. You'll find them trying to touch different things around them, like as if they're trying to feel. They're trying to feel something. They come to you, they touch your skin. They go to the chair, they touch around the chair. They might want something smooth, they might want something rough, depending on how their brain development has gone. So at times we even say their senses are either hyper or hypo. Hyper meaning they are overly high in some regard, while hypo means they are overly low. For example, if they are hyper in the sense of touch, meaning that when they don't want to be touched, or they don't touch around. These are kids who want to remain clean, When they get in an environment that is dirty, they don't want to get dirty at all. While others, on the other hand, are hypo, meaning that their sense of touch is low and they are looking for touch. So when they reach an environment of something rough, they want to keep touching, they want to get dirty all the time. Yes. Thank you.
Okay, so that was so insightful, and I'm happy we're having this discussion this morning, because really, to some parents, they are clearly now when you're talking about the signs of actually autism. I've remembered a friend of mine who used to have a child. The child would not even cry when they were injecting them. Now, we would go for immunization, and all the children were crying. This boy would just look on. You would put this boy in one place, he would even urinate on himself, and the dad used to be proud that, oh, finally, that day omwana ataina atalina ddalu, opposite to what actually all his all whatever other siblings were. So to the parents outside there, that over keeping quiet of your child could be actually a sign that your child needs attention from an autism or autistic expert. Because I believe the problem with autism has been about around misdiagnosis and scant or limited information about it. Where we grew up from, autism was pure witchcraft. If you had a child like that, the first thing they would ask you is who you annoyed when you were pregnant. They will ask you, oh, did you leave your ex-girlfriend before marrying this woman? Oh, the ex-girlfriend has come back to haunt or to hurt your child. So this is one reason why we started this program, educating this Gen Z generation, educating the people about certain diseases such that we make informed decisions. Again, we want to thank our different partners of the day. That is Bosani Leadership Academy or McCall Leadership Academy. Bosani is a well-known Maxwell-trained coach, expert. So if you need any leadership training, if you need any mentorship in leadership and finances, kindly follow the numbers on that poster and then you'll be helped. On the other way is EDSA Foundation. EDSA Foundation is a registered CB organization located in Kayanja, Namatava. EDSA Foundation takes care of children, autistic children inclusive, and helps them to have a life. They provide them with basic needs like books, sanitary pads for girls, and the other scholastic materials to make them afford a life. But also we have other partners like Guardian Angel Nursery School. Guardian Angel Nursery School is located in Ibaka, Wakiso district. This is a nursery school, and they too take care of our children. Other partners will come in along. Mr. Brian, we've talked about the signs of autism. What has been your experience so far working with these children? What are some of the challenges you've experienced, especially breaking it to parents, making them accept that their children have autism? Because it is one thing for us to come here and say, oh, this is autism. But what has been your experience in helping these parents actually understand and accept that their children have autism?
Yes, a number of challenges that we have faced as professionals regarding autism spectrum disorder. Number one is denial. I think many parents, just like any other parent, every parent expects to have a normal child, expects to have their child talking at by 1 year of age, expects their child to be having normal behaviors. And in one expected outcome, if you don't get a normal child, is to deny that your child does not have any problem. So in most cases, you try to hide away from that fact, and many times you try to look away from any information regarding autism, and also in other cases you try to get other professionals to justify that your child does not have autism. Yes. So in this regard, that's a big challenge that we are facing. This is because we find parents bring their child for intervention or treatment when the child is around 7 years, 8 years, 9 years, 10 years, what we call typical school going age, or elementary school or primary school going age. Therefore, we kind of feel this is late intervention. We'd rather have the parent at least seek professional help earlier on, right from 1.5 years, 2 years of age, so that the professionals involved can help this child at least to reach their goals, their communication and behavioral goals faster. Another challenge that we find that we have already talked about are the myths. Yes, of course, there are so many myths going around, and in addition to the myths, we are also seeing the stigma, societal stigma. The society does not approach well what would call things that are not typical to their understanding. When they see a child is behaving in this particular way, they will say, this child is mad. Probably they deserve to be in a mental institution. Or this parent is beating up this child. This child is crazy. The child is crying all the time. So probably the parent is beating up this child, and they will keep calling the police to intervene on this parent. Yes. In other case, in schools, like I work a lot in schools, so you'll find schools have had a difficulty including these children. There are some schools whereby the parent has told you clearly that they have taken their child to this school, and the headmaster or the principal, the director has said, we do not work with physically disabled children. We cannot handle this child in this place in any way. So schools have kind of, instead of looking out to find means of including these children, they just push away these parents, and these parents find themselves in kind of a box whereby they don't know what to do. They don't know what to do. Another thing is there are many quack professionals. Another challenge we find, there are many quack professionals, right from professionals trying to provide all kinds of false herbal remedies, false medical remedies, trying to provide, other professionals trying to provide all kinds of false therapy and false hope regarding, and parents. We understand that parents are at this point whereby they are very desperate. They are trying to find all means to make their child typical, to make their child like any other child. And the issue is that time is running out for them, so they are trying their best. So these are the challenges that we are continuously finding. Also, another challenge that I've noticed is professionals. Many of the professionals in the medical field, in other fields, do not know what autism is, and many times they kind of give a wrong impression to the parents. Yes, you find maybe a doctor who is listened to by many parents. When the parents go to this doctor to tell them about what's going on with their child, the doctor will tell them, no, your child has no problem. Your child will be normal in maybe a couple of years, maybe in 1 year or 2 years. Your child is going to be very normal, very okay. Yes. While in other cases, the doctor may tell them, the truth is that nothing can be done. Nothing can be done. This child is disabled. This is for life. And what I would tell you is just go back home and keep this child at home. Yes. So you find parents are stuck. They don't know what to do. Thank you, Richard.
Again, to someone listening from there, if you have any question about autism, eri abalabi baffe abatulaba lyo twogedde lunyaanyimba oba luzungu kuba omugenyi waffe lwasinga otegeera. Bw'oba n'ekibuuzo kyonna ku autism, nkusaba okiteeke mu comment section. Tekitegeeza nti omwana wo yakirina, yalina obuzibu bwa autism. Naye nga bwe nabagambye nti abaana bangi mu community zaffe, so many children in our societies or under our care, balina autism. Ffe tulowooza abaana balina eddalu, ffe tulowooza abaana basirise, ffe tulowooza abaana balina effujjo, oba tetubategeera. Bw'ogendako mu nsi zino nga za America, osanga ng'abaana bangi abalina autism era batandise obbakolerawo programs ezaabwe. The time I got exposed to and understanding autism, I started accepting nti bantu bangi actually ne mu nsi zaffe oba Uganda betwalabanga tatadde autism ne tetwakitegeera. Ne tulowooza nti basiru mu kibiina, ne tulowooza nti tebategeera, ne tulowooza nti balina effujjo, simply because we misdiagnose. We are going to take a rest, and when we come back, we are going to look at diagnosis, we are going to look at treatment, and we are going to look at speech therapy. how does our expert help these children in coping up with their speaking capabilities? Again, if you're there and you've not yet joined local football appreciation awards, go to www.lfa and then be part of the bigger goal, or be part of celebrating Uganda's finest when it comes to football. Let us be back after this break and we shall go into our last part of the day. Thank you so much for watching again. If you've not subscribed, please subscribe right now. Subscribing up channel eno because guno omwezi tulina tuba parkingidde abakugu ab'enjawulo ku ndwadde ez'enjawulo nga bwe mwatusaba. Thank you.
Imagine football, where every cheer, every story, every blade of grass counts. The Local Football Appreciation Awards celebrates not just the players, but the heart of our community. From the media to the groundsmen, from the fans to volunteers. Join us in honoring the real heroes behind the game. Celebrate football's true spirit together. Don't miss the event where every role is recognized, every effort appreciated.
Okay. Tubakulisaayo mu bulango oba mu kalango kabanaffe aba Local Football Appreciation Awards. Bano nno award z'omupiira ezivuddeyo okusiima abantu ab'enjawulo abakoledde omupiira mu Uganda. Ngere award zino zigenda kubeerawo ng'ennaku z'omwezi lumu August. Tukusaba ogende ku website eyo eya www.lfawards ogende category gy'oyagala olonde omuntu akusingidde. Okulonda kugendya ddala maaso paka ng'ennaku z'omwezi 3 omwezi guno. So mujje tu celebrating bannabyamizannyo b'omupiira nga tugenda oba nga tubasiima nga bakyali balamu, tuleme kulinda baffe olwo tulyoke tuveeyo nga tubasiima.
Ali Tomusange Award. In Uganda's refereeing arena, one name stands tall. Ali Tomusange, our most decorated referee who tamed fiery clashes from Kampala to the 2002 World Cup. The Ali Tomusange Award honors his legacy, celebrating the best of the best. Meet the nominees. Shamira Nabada, the Iron Lady ruling global pitches. Kasalire Lucky Razek, the consistent vet with a whistle. Asadu Semere, the Chief Justice of Football. And Otek Daniel, the rising star from the Northeast. Vote for your top referee at the lfaawards.com. Let's honor our local heroes.
Okay, thank you so much. Mr. Brian, you're welcome. Kansubire onywedde kachai in a break. Let's go straight into our
Definitely.
part 2. How do we diagnose autism? We've looked at the spectrum. How do you diagnose autism, and who confirms actually that it is autism?
Yes. If you have a child or you have a friend who has a child who you think is exhibiting or showing characteristics of autism, I advise that you go to the hospital. Best is definitely if you are able to go to Mulago Hospital, if you are able to go to other national referral hospitals, that would be the best. You look for professionals. The number one professional would be a pediatric neurologist. That means a brain doctor for children. Yes, pediatric neurologist. Then number 2, a clinical psychologist.
Okay.
Then number 3, a psychiatrist or a doctor of mental disorders. Yes. Then also a speech and language therapist would be able to tell you if your child has characteristics in the direction of autism. An occupational therapist is able to tell you if your child has characteristics in the direction of autism. Yes. And in diagnosing autism, there's what we call diagnostic criteria. There are a number of diagnostic criteria that they use in diagnosing autism. These are standardized. These are standardized, and this can be used by the professionals to ask you a number of questions and also observe the behaviors and characteristics of your child in order to tell you that they are or they are not autistic. Yes, thank you.
Okay, so that's how we diagnose. What are some of the so after diagnosis? I'm happy you've talked about Mulago Hospital, where me and you work. Exactly. Do we have a department in Mulago Hospital where mothers or parents with children who may exhibit the signs that you talked about earlier, that would say maybe go to this ward? Because we have a beautiful Mulago Hospital, but because of its size, it is complex. So many people get lost on the way and actually give up on the way. Do you have specific areas where you will tell a parent out there that is watching this program that actually, if you go to Mulago Hospital, you go to this department of ogenda ku one with this or this that, to make sure that they don't spend the whole day? Because I've met parents that actually spend the whole day looking for something in Mulaga and eventually they just give up and go back, especially when it comes to children. Do you have specific direction? Like, or you go to this ward or to this is where, or you ask for this, whatever, you will be directed?
Yes, when you, like in Mulago Hospital, when you go to psychiatry in Old Mulago, majority parents discover that their child has autism when they have been sent to psychiatry. Psychiatry is found in Old Mulago. Yes. Then number two, when you go to neurology, neurology is in New Mulago. That is fourth floor, New Mulago. You'll find neurology. Then also speech and language therapy clinic. The speech and language therapy clinic is found on the first floor of New Mulago. Yes, first floor of New Mulago, just near the ENT ward, the ENT ward. Then also occupational therapy. Occupational therapy is found on the second floor of New Mulago. Second floor of New Mulago, towards radiology. Yes, where they scan, you'll find occupational therapy. It's also next to physiotherapy. Yes. Now, at psychiatry, they will definitely, since autism expresses itself through behaviors that are not normal in typical individuals, psychiatry looks at mainly those behaviors that are not okay. While neurology now tries to seek a physical difference in the brain. Neurology will try to look for, maybe, does this child brain, is it larger than a typical brain? Are there some challenges in the brain that can be clearly pointed out? Yes, like a physical characteristic. Now, occupational therapy and speech therapy are on the treatment side of things. So when you go to occupational therapy, you expect your child to be looked at in terms of, this child is exhibiting sensory difficulties. The child is maybe climbing a lot. The child is very hyperactive. They are running around all the time. They don't sit down in one place. Or the child cannot brush their teeth at an age when you expect them to brush. They can't bathe when you expect them to bathe. So occupational therapy helps in that area, while speech therapy is directed towards this child's communication. This child is not talking. Why aren't they talking? Can we make them talk? If they're not talking, can we find ways of giving them an alternative form of communication? Yes. So all this, as a parent or as somebody involved in the child's life, you can be directed properly when you get to Mulago in these specific areas and what they specifically do. Thank you, Richard.
Okay. Thank you so much, Brian, for that thorough explanation. Because to me, government of Uganda as we try to put facilities in place, but sometimes our patients do not know where to find us. So someone thinks about coming to Mulago, then they also think about locating the place. But I'm happy that you've given a thorough explanation of the location of the different units where autistic children can be taken. Please, if you're there and you have a question, leave it in the comment section or put it in the comment section, and we are going to be able to address it before the end of the show. What are some of you've talked about the treatment, the treatment and the management aside. Now let us go straight to what you do. You were a speech therapist. First of all, who is a speech therapist? Because there could be, this program is also watched by students. Who is a speech therapist? Because sincerely speaking, you know we are friends for so long. You're the first and the only speech therapist that I know in East, not actually in East Africa, in the whole of my life. I've never met. I've served in about 6 countries now. I've never met another speech therapist. Actually, when I was thinking of a speech therapist, my brain had only one person. Who is a speech therapist? What do you do? What do you study? How do you become one? And then later we shall come and discuss lastly your involvement in autistic healthcare provision or your service towards the autism or autistic children.
Yes, a speech and language therapist is a medical professional that deals with communication, swallowing, communication, and swallowing. Yes. When you hear of speech, I basically mean what is coming out of my mouth, orally what I'm moving my mouth to speak. Yes, that is speech. Then language, just like we say speech and language therapy. Language, on the other hand, is what is happening in my mind to express myself finally. And language goes beyond speech. Language goes my eye contact, my hand movements, my other movements that are all trying to communicate. I'm trying to express myself. So speech and language is that. Now, a speech and language profession, just like I've said, I go and assess a person who is having difficulty in speech and language, and also swallowing difficulties. If an individual is not able to feed properly their food, whether it is due to an issue in the mouth, an issue in the throat, yes, I'll be the professional that will come in and advise on what to do. Now, in Uganda or worldwide, to become a speech and language therapist, number one is definitely you'd have wanted to be a speech therapist. Yes, the need to be one. When you see the society has a need for speech therapy, when you see there are these different people who cannot speak, these different people who cannot express themselves, different people who are not able to feed properly, you view the need. Then number two, you ask yourself, what can I do? Yes. And it's a medical profession, so to become a speech and language therapist, you'll have to have a liking towards medicine and medical things. Yes. Like in Uganda, at around S4, you'll already want to be a medical professional. Then around A level, that is S5, S6, you'll pick things dealing with the medical professional, particularly subjects such as chemistry and biology. Yes, chemistry and biology. Then after your A levels, you'll go forward to pick the course. Currently, the course that is there is a bachelor's degree. In Uganda, it's only at Makerere University. I think in a while, maybe in less than 5-10 years, we should have another one in probably Mbarara University. Yes. In East Africa, we are having in Kenya and in Tanzania, Kenya and Tanzania. And in Africa, I think there are a number of countries, South Africa, Nigeria, Egypt that are having, Ghana, that are having these courses right from the bachelor's degree. Yes, currently in Uganda, we're having at Makerere University under the Health Sciences College. Health Sciences College. Yes. Now, after studying, it's a 4-year degree, a 4-year degree. After studying this degree for 4 years, then you're expected to go ahead. Actually, within the 4 years degree, there are different internships, different places you are placed to observe and also interact and also assess and treat different individuals with speech difficulties. Now, speech therapy is a specialist medical course whereby your line is definitely only with communication and swallowing, and also you work with individuals right from birth up to elderly age. Individuals at birth, you expect children who are not picking their milestones of speech quickly. Then later on, you find individuals who have reached their adult age, teenage years, who are stammering, who cannot talk well. Yes, as we see. Then also later on, you hear of individuals, maybe they have got into a border accident, or they have got into traumatic brain injuries. The person maybe was hit by a thief early in the morning when they were going to work, as you heard before, and their speech, they are not able to speak anymore. Or maybe we have a teacher at school who's very enthusiastic and they are always speaking a lot, so their voice gets dry and they lose their voice at some point. Yes, they are not able to speak to their students as they wanted before. Then also we've heard of increasing in strokes, or what you'd call resulting from non-communicable diseases like diabetes and hypertension. So the individual gets a stroke and they cannot be able to express themselves. They get paralyzed on one side and part of their brain is damaged, so they are not talking properly. So a speech therapist comes in to intervene.
Okay.
And many more other things that deal with speech and swallowing. Yes, thank you.
So straight to the point. What's your role in autistic?
Yes.
When we are looking after autistic patients?
Yes, as a speech and language therapist, my number one role with autistic individuals is to screen if they require my intervention. Meaning that if I'm presented with a child or an individual with autistic characteristics, I'll first find out, is this person's communication very limited that they would need me to come in and help them to develop their communication? So I will screen that. Then number two, I'll go ahead to assess how challenged is their communication. Are they able to make a single word? Is that single word they make intentional? Can they make sentences? Are those sentences able to express their feelings, their needs? Yes. Then I would go ahead. Are they able to use nonverbal communication? Can they point at something when they see it, when they want it? Can they nod their head for yes, as society, as Ugandan society would expect? Or can they say no? Or are they able to follow their typical communication routines? When I wake up in the morning, can I say can I go and greet somebody good morning? Can I go and talk to my parents? When I go to school, can I speak to my other children with me? Can I tell them how home is, how happy the weekend was? Yes, so I will assess that. Then when I see that there's a challenge there, I will go ahead to to intervene in their treatment. I'll go ahead to see what way can I get this child to communicate. Most parents expect us to go straight forward to make this child to talk. I want my child to talk. Yes, that is the expected outcome. But as a professional, what will be at the back of my mind is how can I break that barrier, first of all, of communication. I want to go straight to speaking, but I'll first go to, can I find a way of realizing what this child is communicating by the behaviors they are expressing. Maybe the behaviors they are doing, the jumping around, the flapping, the closing their ears, is a mode of communication. So can I first point out what they are trying to communicate through that? And can I direct those forms of communication that they are showing towards a more formal version? Can I say that when this child is blocking their ears, this child is meaning this? When this child is holding themselves tight in a space or a corner, they are trying to mean this. When they are jumping in a single place, they are trying to mean this. Yes.
In other words, Mr. Dr. Brian, you're trying to tell us that one way of helping this child, actually, first of all, is to understand their way of doing things. Because by doing whatever they are doing, there is something that they are trying to communicate to the people around them. Could be when they are doing this, they don't want noise, or they are telling you it's too cold. So first of all, what they call it, in intelligence, they call it decoding. You're trying to understand what this child means by whatever they do. When they are throwing tantrums, what are they trying to communicate? So what you do, number one, what you do is you try to help the people around this child actually understand what the child is communicating with whatever they are doing before even you come in as a speech therapist. Because I think many times parents think when Mr. Kagombero Brian comes in, oh, the following day my child is going to speak. But you put it right that communication actually can be verbal and non-verbal. So first of all, you help them understand their child and what they mean by different things. Then later on, you try to establish the speech challenges and how you can. Is that what you're trying to mean?
Definitely, yes. Yes, so just before that, Richard, your network is a bit, it's breaking, going off and on.
Oh, sorry.
Yes. Now, that's what I'm trying to mean, that as a speech and language therapist, I will deal with this child, first of all, as an individual. As professionals, we don't like to just build a single circle around all children, that all these children are the same. No, we prefer to approach each and every child as an individual. We want to see, let me just give an example. We want to see probably Brian is showing these characteristics. What is Brian trying to mean? And you'll find that each child with autism acts differently from another child with autism. Actually, we always say that one child with autism is just one child with autism. They are not the same as the other as others. So when we approach this child, we want to study their mode of communication. We want to study what are they doing differently from other children, and maybe they are flapping this number of times, maybe they are jumping this number of times, maybe they do it in the morning, maybe they do it in the afternoon, maybe they do it in the evening. And we'll get this information through assessing and observing this child. Then we'll go ahead to form what we call a tailor-made or a custom individual profile for this child. That Brian exhibits this number of characteristics, and these characteristics mean this and that. Then we'll go ahead to push our intervention in what we are going to do, what we would call a treatment protocol. A treatment protocol that with this child, we are going to start with this, then go to this, then go to that, then observe as we are carrying out these different changes, and see how they are they are changing towards our treatment. Yes.
Okay. Very, 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 very important and very informative. I believe to everyone watching in this morning, you don't regret the time you've spent to watch today's program. I'm learning a lot of new things, and actually I'm learning to be more observant, but also takes us back to, as parents, to just be a little more observant with our children. Like each time we host specialists here, it really takes us back to parents being parents again, not just having children and we leave them home. Because Mr. Brian, at what age do we normally in Uganda average do people actually come to detect autism? Is it like early stages?
Where majority children that we get, actually, I'm kind of happy with many Ugandan parents due to the gadgets, especially in Kampala, where out of Kampala may be a bit harder, but especially in Kampala with increased use of technology, of smartphones, smart TVs and computers and laptops, being able to access the internet, we're having more and more parents come earlier with children with autism. Yes. Early on, probably when I said working with children with autism, maybe around 8, 9, 10 years ago, we used to find most parents would bring their children when the child is 7 years, 8 years, 9 years, 10 years, and that's when they would realize that my child has autism. But currently, we are having children as early as 3 years, 4 years, and 5 years. Yes, majority actually around 3 years, majority at 3 years that have, from my experience, at least in the last 3 years, 4 years, we are having children come as early as 3 years, 4 years, and that is great for treatment and management as regarding to professionals. Yes.
If you're here and you have a question, now is the time when we normally go into our question and answer session with the expert. But I have some questions that came into my DM when we were actually programming for when we are starting this show. Brian, the first question comes out of your experience. How have schools and government of Uganda managed to help children with autism? How are schools handling it, and how is the government handling it?
Currently, it is what can I say, an area of little knowledge for most of our school educational entities. So many schools regarding government and many policies regarding autism are not there at the moment. We are just trying to create kind of pressure groups through parents, through professionals, speech therapists, occupational therapists, special needs educators, who are going ahead to approach government, like the Ministry of Education, the national curriculum for preschools and primary schools, to get them in the knowledge base that the truth is that these individuals are existing before us, and we cannot hide that fact, and they can be helped. They can be helped by the different professionals around, and they should be allowed in school. As a speech therapist, we always encourage inclusivity in typical schools. We don't want these children. Already, these children are having difficulty in social interaction, so we don't want these children to be excluded away from typical children. We want them to be in a base of typical children, so they can be in that continuous environment with communication, so they can be talked with, pushed around, told this and that, so they can absorb what typical interactions are. Yes, so currently we don't have clear-cut guidelines in our Ministry of Education or in our schools regarding autism spectrum, but we are pushing for that as organizations of parents, organizations of therapists and other medical professionals. Yes.
Thank you so much, Brad. Because I was just here imagining that in the recent past, I've been part of movements to just help children with disabilities that are actually physical, that everyone can see that they struggle to access things, especially in different, like when you go to hotels, when you go to tall buildings, to just put them things like lift, things like walkways where they can carry their wheelchairs. Now I'm imagining the pain for autism, which still even have a challenge of being accepted that it is actually a health condition. I was just imagining, that's why I brought in that question, that how actually are schools coping up with this? Yes, with international schools like Charm International School, Guardian Angel Nursery School, I know one of the things that actually we discuss with them is inclusivity when it comes to children with, I will call them special needs, because autism, I think, is a child that may need a little bit extra need compared to the other children. Not because they are abnormal, but because they are designed in a way that is different from the other children. That does not make them abnormal. I'll give an example of a child I know that at the age of actually about 15 or 16, he's been employed at Apple, at one of the busiest places, because the guy is so good with Apple gadgets. He can, if you gave him anything Apple in his hands, in a minute he will remove your password, he will decode it. Actually, the time came when actually they were now protecting him against that. So he's so smart in a way that his understanding is beyond any of us. So these children actually a blessing in this guide if we find out what they can do better. And that brings back to the next question. It may not be so scientific, not so anything. What is it with autism and gadgets? To you science that are dealing with these children every day, what do you think brings that attachment? That when you give him your phone, it's like you've given a phone to a robot. It's going to do so many things with this phone. Clearly, in just a minute or two, what do you think is the connection between these autistic children and the gadgets?
What I can say is going back to the core brain development of individuals with autism. Successive and continuous research has showed that individuals with autism do not exhibit interactions with human beings as you would want. For example, MRI scans, especially functional MRI scans, have showed that when an individual with autism when a typical person comes to approach an individual with autism, the area of their brain that is supposed to light up on the MRI scan does not light up. It's like nothing has happened, like they have not observed your presence. They have not observed your presence. They don't see the need to interact with you. Yes. While that same area of the brain, when they get something they like a gadget, that same area that's supposed to deal with human interaction lights up for gadgets. Yes. And this is because individuals with autism, their brain consistently pushes out human interaction. This is right from childhood. They do not provide eye contact like the eyes. The eyes are the ones that enable us to create first step of interaction in most human beings. And you have to in order to learn communication, you have to look at somebody speak. You have to be involved in how they are communicating, then also learn to communicate the way they are communicating. Like you just keep copying and pasting. The other person is just a model or a blueprint of how you're supposed to talk. But these individuals do not look at that. While in gadgets, they don't feel that pressure that I need to look at somebody. With a gadget, there's nobody looking at them. And the gadget has a number of feedback that it provides to their senses. For example, autistic individuals have been known to love colors. The gadgets like cartoons especially show a variety of colors. A number of these individuals have been known to love a variety of sounds. And these gadgets provide an array of different sounds that this individual enjoys. Another one is the constant movements that we see in these typical gadgets. Like they are always interactive. The cartoons are running here and there, or doing this and that. And funny enough, even some individuals have been found to not love cartoons, but love specific programs, right from childhood. The child may love maybe a soap, maybe a series, maybe cars, maybe these different things. So these appeal to their brains in a specific way. Maybe as a professional yourself, Richard, you've heard of dopamine. So kind of this feeds into their dopamine supply. It constantly opens their dopamine channels to properly constantly make them have a feel good feeling. Yes, it's like an addiction that they get into over time. At first, it's just something simple. Over time, it becomes an addiction. Yes.
Okay.
Thank you.
I think you've given us a proper explanation also, because it was always in my mind that what's the connection between gadgets and because now I'm an imaging expert, it brings me back to the next discussion question. This just popped out. What's the role of MRI in the diagnosis of autism?
Yes, MRI is magnetic resonance imaging,
Yes.
and MRI deals with looking at mainly soft tissues of the brain. I mean, soft tissues of the body,
Yes.
and specifically in regards to autism, you're looking at soft tissue of the brain, like how the brain cells are arranged, are structured. There are two types of MRI. In particular, there's the structural MRI and the functional MRI. The structural MRI shows how the different brain structures are at the moment, while the functional MRI shows you how the brain is functioning regarding to differences happening outside. Yes, for example, if, like how I said, if I come to greet this individual, the brain will start lighting up in different places, and this can be seen on the computer screen of the MRI. You'll see the orange, the red, the green, the yellow in different places of the MRI. Yes. So the MRI helps us to see what is happening in the person's brain. Yes.
Okay. Okay. Thank you so much for that. Then this is sent from my friend Sarah from where you get it, and she says that how have you managed to prevent autistic children from quack doctors? Because she says that the quack doctors, or not actually, I will not say quack doctor, but the quacks in everything. People in buses selling medicinal things that help with tooth decay or dental things. Now, how have you managed as people at the forefront of providing health care to these children or in different associations? How have you protected them from quacks, especially people that are witch doctors, people that tend to tell these parents, oh, these problems will go away on their side? Because I honestly telling you, before having a discussion about autism and reading about it and actually taking interest about autism as a disease, I used to hear so many health workers tell parents, "Anti omwana akyali munafu." The bones are just still weak, because the parents would bring their children. Oh, the child is about 2 years, he's not speaking, he's not crawling, he's not doing anything. Omwana akyali bunafu. Naye bw'anaakula when they grow up, the senses are going to develop. That was, I think, misinformation. Now that I've learned about autism and a few things, how have you managed to protect these children from misdiagnosis? First, within the healthcare providers themselves, because of little knowledge about autism, but also to the other non-medical people, like witch doctors, like I'm a religious person, but religious leaders in those brackets who want to chase demons even where there are no demons. How have you managed to fight for the rights of those children? Because I'm telling you, their protection strictly lies in your hands. If you don't fight for them, just like the albinos in some countries in East Africa, they were being witch hunted for, I hear, blessings, what? I'm totally sure that there are some societies that see these autistic children as either blessing or curses. And the power to protect them strictly lies in your hands. How have you managed to protect them in that regard?
Yes. As professionals dealing with individuals on the autism spectrum, we have pushed a lot in regards to sensitization. Number one, sensitization of our fellow professionals. Like, for example, in Mulago, each department has a monthly meeting whereby they accept other people from other departments to come and present something regarding to something that you look at as critical. So these sensitizations in the hospital have helped to let other doctors and nurses and other professionals to know what autism is exactly and what signs to look out for, and also to also not use improper communication, improper feedback to parents and other individuals with this problem. Yes, another way is regarding to the general population is constant sensitization. Year in, year out, we constantly have conferences, we constantly have campaigns, we constantly carry out school visits, we constantly come on TV, come on radio, talking about autism spectrum disorders and also other developmental disorders. And also directly the smartphones in terms of these social media channels such as Facebook, TikTok, Twitter, WhatsApp. We are having constant information increasing. I think if I look at 10 years back when I was in school, the ignorance was higher as now. 10 years back, if you told somebody what is autism, like out of 10 people, maybe 2 or 3 would tell you what it is. But right now, I've noticed around, I think, roughly 6-7 people can have at least a faint idea of what autism is. Yes, so the knowledge the knowledge gap is widening.
Okay.
Yes.
And as we wind up, someone has sent me a DM asking, Doctor, do we have autism in adults? Because each time they hear about autism, we talk about children. And this person is asking, where do those autistic patients end up? Do we have autism in adults? I think you talked about this earlier when we are starting the show, but you can answer this person in a minute or so. Do we have autism in adults? Are there some?
Yes, definitely.
Are they actually? Let me just mold it. Are there some undetected cases that eventually detect in adulthood that maybe we missed at early stages of life?
Yes. Definitely, we have a number of individuals in our society with autism. Autism is not a disease. We don't like to call it a disease. At times, we prefer to call it a brain difference. There are individuals who have what we call typical or society-based known reactions, and there are those who react differently. Yes, so we have a number of individuals with autism who grow up into adulthood. Some of them, some things that we consider that may put somebody, an adult, in to have autism. One of them is social interaction. Many individuals who prefer to be alone have a high chance of exhibiting autism. Many individuals who prefer to be in maybe a secluded profession, something like always wanting to be on the computer, don't want to be around people, or maybe they want to be in the lab, or maybe they want to do art and be alone with their art, and they don't want constant human interaction. There's a high chance that this person could have autism. Then also their communication. Many individuals, maybe some individuals who speak too fast, whose communication is not typical. There's a high chance that they may be autistic. Yes, also in other cases, individuals who are hyper, who are hyper in their, like, they are obsessed. They can't sit down in one place. They are always what you'd say jumpy. Who are jumpy. There's a chance that they could be autistic. Yes. Then also another case, we have what we call OCD, or obsessive compulsive disorder. In cases whereby this individual, what we call in our society perfectionists, we tend to call them perfectionists. This person wants to do things in a particular way. They don't want to change. When they put their cup in this place, they don't want even the cup to be moved an inch. They dress up in this specific way from Monday to Sunday. They want these particular clothes. They arrange their house. When you go to their house from January to December, the broom is in one place. The broom is in one place. The table is in one place. The curtains of this particular color, they always want this particular color of things. Any change to that routine or to that way of doing things is completely disorganizes them. Yes, so many times these individuals, we could always think that there's a high chance they may be autistic. And because the labels and the intervention has come right now, we didn't diagnose this early on in Uganda, and even in the developed world, it took a while to start diagnosing these people. Yes.
Dear friends, from what our expert has said today, it brings me to an understanding that actually I have, I think, so many autistic friends around me, only that they have not realized. I know so many people that so many people that are very talkative, myself inclusive. I think I need to take a test. I need to consult Dr. Brian and the rest to see. I may be I may be one of the most famous autistic patients in the world, as I'm going to take a test. I know people who are so perfectionist. Kathy can see me. Where you put your cup, you don't want anyone to move it. I know people that want to do things in hiding, like they always want to be alone. So exactly that's what this program was meant to do. Discovering things that we thought we knew and yet we didn't know. And I'm telling you, in the next 10 years, we are going to discover that almost we have an autistic child in every family in Uganda. So the more we understand these diseases early enough, the more we come to accept these people in our society, and the more actually we start to make things around us easy, and we make life comfortable for them. Because trust me, if we don't accept them and help them, then we are not helping them to socialize. Actually, Dr. Brian, I said something very important, that majority of us are wired in one way that we call normal. Now, autistic people are wired in another way that is also normal. I normally tell people that something being famous, not everyone doing something makes it the perfect way. It could be that actually the one that are wired in a normal way, and it's just that abnormal, only that we are we are many in number. So we have to accept these children the way they are and handle them the way they are. Dr. Brian, as you finish, I want to, before you come in with your closing remarks to the parents and everyone that is having an autistic child or autistic patient under their care, I want to take this special opportunity to thank Mulago Hospital. Dr. Brian, you'll agree with me that so many times people come and talk so ill or so negative about Mulago Hospital. But after moving, I say, to about 6 countries, I now come to accept that actually Mulago Hospital does offer so many services that so many people keep quiet about. To people in other places of the world, if you talk about autism and the cost of management that you have to get involved just to help your child cope up, is so big. So I really want to thank Mulago Hospital under the management of Dr. Byanyima. Thank you so much. We really appreciate your contribution to the healthcare system in Uganda. We thank you so much for standing in that gap, for lobbying for Mulago Hospital, the entire leadership structure at Mulago Hospital, management structure, Minister of Health. Thank you so much. On behalf of the patients, autism group, or autism patients in Uganda, I want to thank you for the support and care you give to them. We kindly ask that actually the funding from government and all non-government organizations towards autism is increased to make sure that we have easy detection, easy management, and easy support. To all the organizations that are helping Mulago Hospital handle autistic patients, thank you so much. To all the leaders and all stakeholders in Uganda, let's support Mulago Hospital, especially when it comes to budget allocation. We normally see Dr. Byanyima suffer or being questioned when she goes to the parliamentary committee to front the budgets of Mulago. And many times Mulago does not even get like 100% of its budget. And when we fail to pass this budget, then we come back to blame when there is shortage or provision of some services. I kind of ask all decision makers, all people in places of governance, all people in finance, kindly help Dr. Byanyima when she comes with that budget to give her 100% of what she asks for. So many of these diseases we don't know. When we talk about diseases, people rush to talk about accidents because that's what we know. We rush to talk about HIV, AIDS. We rush to talk about maybe, but there are so many of these silent diseases that Mulago actually is handling and taking care of. So on behalf of everyone that loves the best for Ugandan healthcare system, I kindly ask that we support Dr. Byanyima and our executive team by giving 100% of the budget she always presents before the Parliamentary Budgetary Committee to make sure that the silent diseases like sickle cell, silent diseases like autism, and the non-communicable diseases that are steadily starting to show up, that we are actually now starting to diagnose very well, can be well taken care of. Majority of the patients of these diseases are children that are not going to go on the streets to strike, are children whose parents maybe are not so many that they are going to go on the streets and strike. So the only way to support them is by making sure we give these hospitals, especially our National Referral Hospital, full budget funding to make sure that they plan for these hospitals so well. So in a special way, today's program, I want to appreciate Mulago Hospital and especially the director, Dr. Byanyima Rosemel. To me, you've done the job very well. To me, you've supported children and patients of these silent diseases, and we pray that the good Lord will continue to use you towards supporting this care. And every staff of Mulago Hospital, we know the world may be so harsh again on you. People may not appreciate, but us that have worked with patients in Mulago Hospital, us that know that you handle more than 3,000 patients every day, everyone at this page, we really appreciate you. We really say you're heroes, you're unsung heroes. We applaud you. We are happy with your services, and we pray that the good Lord may continue to reward you, motivate you, and bless you in everything. Dr. Brian, your closing remarks towards this. what is your message towards all parents that are taking care of autistic children, organization, and everyone? And then before you actually give that, our promise as the channel towards autism in Uganda, every month we are going to give one person that deals with autism to come and say something about autism as we create more awareness up the end of this year. We want to make sure that everyone in Uganda at least knows one or two things about autism. That is the only way we are going to create awareness, then uplift the healthcare service provision for autistic patients in Uganda. Your closing remarks to the caretakers, patients,
Yes.
and everyone taking care of autistic patients.
Yes. First of all, I'd like to re-echo thanks to Mulago Hospital, to Dr. Byanyima, to also the ENT department that speech and language therapy is under. They have played a very, very supportive role in autism intervention, in ensuring that the speech therapy department remains open and providing the materials and different requirements that can help the speech therapists work with these individuals. Yes, I would also like to thank parents. We are really having very strong parents, especially mothers. I would really wish also the fathers to come on board. Yes, most cases we find the fathers are mostly in denial, but we would like also fathers to come on board. We are having very strong and championing mothers in the autism area. Very many mothers really seek out the information. Right at the clinic in Mulago, we mainly get mothers coming. I think I get more happy these days when I see fathers coming. Yes, we are having fathers coming in also with the children. Yes. And my final regards towards autism is telling you as parents, as individuals, is that there's a lot of hope in managing and helping children with autism. Yes, it is not bleak or dark as we thought before. Now we have different interventions. We have occupational therapy, speech therapy. We have special needs educators. We have behavioral therapists around us. We have all these different professionals who are now ready to come in and help. Yes. In Mulago, the speech therapy clinic is open 2 times in the week. That is Tuesday and Thursdays. Feel free to come in to find out more about your child or any individual you have, maybe your sibling, your younger brother, your younger sister, who might have this challenge. Feel free to come in and we see a way forward. Yes, the services are free of charge. Do not expect to be asked for any single coin. Thank you. Thank you all for our dear viewers. Yes, we are very thankful for this. Thank you, Richard, also for this platform.
You're welcome. Brian, before you go, could you say something about this? About the so-called genius at young age, I mean exceptional intelligence.
Yes, I would like to say that is kind of a myth.
Okay.
That is kind of a myth. Geniusness is found in both typical individuals and individuals on the autistic spectrum.
Okay.
And in the autistic spectrum, we also like to break the spectrum into low functioning individuals and high functioning individuals. Low functioning individuals are those who exhibit intellectual difficulties, like they are not geniuses, and they are possibly having very high difficulty in classwork. While the high functioning individuals are those who now we classify closer to geniuses. Like we've heard of individuals like Bill Gates, Steve Jobs, Albert Einstein, and others who are thought to have been autistic or who are thought to be autistic. Yes. So constantly, I would like to say it is not that all autistic individuals are geniuses. No, it's a big myth and a lie. Yes, we find both those who are geniuses and those who are totally not geniuses, just like what we find in the typical population. Yes.
Okay. Again, mine are always reminder. Thank you so much, Dr. Brian, for your time and for being here with us. I always want to remind our parents and everyone that there is hope. So many years, what you thought was non-treatable, today science has advanced and we are able to manage it. I want to thank all the healthcare providers in Uganda and in the world over. Thank you so much for being at the forefront of fighting diseases. As Mr. Selfcare, my role is simple every single Sunday morning, is to inform the public about diseases. I believe the more we understand about healthcare challenges and diseases, the more we are going to be able to make informed decisions. My role is to inform. Your role is to ask. To my family in Uganda, I really want to thank you for being there for me, for standing in the gap for me, my lovely daughter. Thank you so much. I love you. I miss you. Hope to see you soon. To my support system, to my inner circles, to my fellow believers at Watoto Church and the rest of the world, glory be to God, and we thank God for this opportunity. The Bible calls us to serve and to share our gift with the rest of the world. I believe my service and gift is sharing healthcare information with the rest of the world. Your chance or your response right now could be sharing this information and this video to every child or every parent that could be having an autistic child, or every parent that could be looking after one, or anyone that have a child that they are not sure if the child is autistic or mentally disturbed. Because I think there is a thin line between diagnosing an autistic child as a mentally ill patient. I think that we shall discuss that next time. But like I've said, my role is to inform the public. Your role is to see and share this video. We don't charge anyone to attend this channel. We make it free. So do not be so selfish of this information. After watching it, please share this information with all the parents, with all intending couples, in all your places of worship, because this is where people come. If we don't give them the right information in the right way, then it could be they are going to take these children to shrines or to witch doctors. So be Christian enough this Sunday and share this information to all your friends, just like you share all the other quotes and music. Again, thank you so much, Dr. Brian. And I promise that every month we are going to have someone from the Autistic Society or Autism Society, from survivors to healthcare givers to people that are looking after these children. I have a friend of mine who is a dentist who was actually discussing with me how they look after the oral needs of autistic children. It's also another interesting story to hear. So yes, there is hope. The operation is Light It Blue. We are going to create more awareness on autism at all levels. And that's all we can do. Thank you so much for watching us from whichever part of the world you've watched us from today. From me, myself, the production team, our production director, Mr. Chamagero Andrew, we wish you a very good Sunday and may God bless you. Thank you and have yourself a good bye.